Altered Physiology, Mechanisms of Disease 2, a continuation of our lecture series on the cardiovascular system. In this week's episodes, we focus on women and cardiovascular disease, followed by congenital heart disease. Here in episode 2, we focus on the prevalence and risk factors that tend to affect women and increase their risk for heart disease across the lifespan. First, we'll start off by looking at the prevalence of cardiovascular disease in women. Notably, it is the #1 killer of women, resulting in approximately 1/3 of all female deaths. And heart disease is also the leading cause of premature death for women. Every 20 minutes, a woman will die from heart disease, and thousands of women in North America will die from heart disease and stroke on an annual basis. This Time magazine report is now nearly 20 years old, yet it highlights this idea around misconceptions of women's susceptibility for, say, heart disease relative to breast cancer. On the next slide, we actually look at some of the risk factors that affect both men and women when it comes to heart disease. Notably, age, smoking, a low high-density lipoprotein cholesterol value, as well as diabetes, all pose a greater hazard in women compared to men. Yet the benefits of cardiovascular therapy for men and women can be the same. Notably, women tend to be safeguarded from heart disease prior to menopause because of the protective effect of estrogen. However, this is not always the case. If we take a premenopausal woman, so a woman of younger age who has diabetes, in fact is able to cancel out the protective effects of estrogen, thereby increasing a female's risk to that of their male counterpart. When we think about age specifically, cardiovascular disease rates tend to be 2 to 3 times higher in the postmenopausal woman. Now, if we look at some of the risk factors across the lifespan, they are highlighted in this diagram. For example, during adolescence, you can actually start to observe family history and how that may increase the risk of heart disease even at an early age. If we look at the young adult female, individuals who have an early age of menstruation, so for example, those who begin menstruation before 12 years of age, have a higher risk for heart disease. If we look at pregnancy, pregnancy has been termed the heart's first stress test. For example, if you delivered preterm, have high blood pressure or diabetes during a pregnancy, it could mean that you are at a higher risk for heart disease. One such example that we will look at in this week's lecture episodes is that of gestational diabetes. It is a myth that all pregnancy-related complications go away after the baby is born, and gestational diabetes is just one example. But well, you would think that glucose control returns to normal immediately following the pregnancy. These women tend to go on to have a much greater cardiovascular disease risk later in life. Finally, we've mentioned the idea of menopause as mitigating risk for heart disease. Prior to menopause, you have the protective effects of estrogen. We say that estrogen is cardioprotective. However, menopause before the age of 45 is linked to a 50% higher risk of heart disease. Cardiovascular risk factors such as cholesterol also increase after menopause. Here is a nice infographic highlighting how pregnancy can be nature's stress test on the heart. Examples of risk factors such as high blood pressure, preeclampsia, gestational diabetes, and preterm birth, and how they may increase a woman's risk for cardiovascular disease later in life. This slide summarizes the risk of cardiovascular disease following pregnancy. In particular, when we say that it is a natural stress test, we are specifying that, in fact, these high-risk conditions that women experience during pregnancy may actually help to identify women who are at greater risk of developing chronic disease later in life. In particular, I highlight the hypertensive disorders of pregnancy, so that includes preeclampsia and gestational diabetes, and hypertension. And these are common medical problems or complications of pregnancy, which were once thought to resolve after the delivery of the child. However, we now know that these conditions, including preeclampsia and gestational diabetes, have serious complications for women's long-term health. In fact, women with preeclampsia represent one of the highest risk populations for premature cardiovascular disease. As an example, for many women with the hypertensive disorders of pregnancy, such as preeclampsia, their first cardiovascular event will occur at a mean age of 38 years of age, which precedes menopause. A woman who experiences gestational diabetes will go on to have a 7-fold increased risk of type 2 diabetes later in life. Therefore, we can conclude that the hypertensive disorders of pregnancy significantly increase one's cardiovascular risk and therefore warrants exploration and an investigation into female-specific risk factors.